it is very important. I'm going to be talking about the symptom because the title is Symptoms, Signs, and Advice. I'm going to be talking about the symptoms. However, before I talk about the symptoms,
Okay.
do you know, ma, we didn't have time to talk about this when we were discussing
Okay.
that when it comes to prostate, you don't need to wait for symptoms.
Wow. That's
Yes,
that's okay. So what do you need?
you don't need to wait for symptoms.
Okay.
Yes, so what we need to wait for is by the time somebody realizes that he has all the risk factors of somebody that can have a prostate enlargement, individuals who are males are expected to present themselves to their doctors, whether they are GP
Mm.
or in the case of Nigeria, because I know in Nigeria there's no GP, but there's general outpatient department. I worked in teaching hospital in Ife, so I know there's general outpatient department where you can walk into.
Wow.
Because you are black, yes, we have talked about race. Race is one of the very important risk factors we want to talk about. Prostate cancer, for instance, is 3 times commoner in blacks than in whites, in Caucasians.
Wow. Yes. Yeah.
So I, as a black man, is already a risk factor.
That's right. Okay.
When I get to the age of 40 in the USA,
Hmm.
they will advise and say, when you get to the age of 40, go for tests.
Hmm. Hmm.
So I am black, that's a risk factor.
That's okay.
I am male,
That's right.
that's another risk factor.
Mm-hmm.
And I am 40
Hmm.
or more than 40. That is how many risk factors now? We've talked about 3 risk
Yeah.
factors.
Three.
Now, in case somebody has a family history of somebody that has prostate enlargement, prostate cancer, that is another risk factor.
Wow.
So we've talked about 4 or 5. For that individual, he does not have to wait for symptom of prostate enlargement before going for test.
That's good.
Now, why I said this and why this is extremely very important is because in the case of people who eventually develop prostate cancers, there are different types of prostate cancers. There is the low risk, there is the intermediate risk,
Okay.
there is the high risk,
Okay.
and there is the aggressive form. I'm going to go over that again. There is the low risk,
That's true.
there is the intermediate risk,
Yes.
there is high risk,
Mm-hmm.
and there is aggressive
Hmm.
type. If this is picked up on time, for instance, a gentleman, 40-year-old, is black, his father or mother, or uncle had prostate cancer or something, and he walks into the GP and they say, "Oh, gentleman, why are you here?" He say, "Well, I'm fine. There's nothing wrong with me." They say, "Really? So why are you here?" "Well, I have an uncle who had prostate cancer or died of prostate cancer. I am black. I am male.
You have
I
all
am
the risk
40." They
factor.
say,
Okay.
so there is factor. And they say, "Okay, let's just do all the basic examination." They begin to ask him questions. Now, what are those symptoms? We call it, when we were in medical school, they told us, they said, call it funuwishi. Funuwishi is Funu, and then wishi is Wishi.
Okay.
Funuwishi. So funu, F is frequency. The person begins to notice that before now he was going to toilet in the, only like 2, 3, 4 times, but now 6, 7, 8, 9, 10 times he has to go and pass urine. He comes back, he's going back again. And the reason why that happens is because there is an enlargement that is already compressing on the urethra where the urine should pass through. So each time it goes to pass urine,
Hmm.
it passes really little because the urine is not able to flow enough from the bladder through the passageway, which is the urethra, to go out. So it passes very small urine per time.
Hmm.
And because the urine is still stored in the bladder, it goes back to the room. It still feels like, but I went to pass urine, now I'm feeling like going back again because the urine is actually still there. And then it goes again. So that's frequency. Then urinary retention. Some of them, now over time, by the time the urine begins to build up in the bladder, they are not able to come out, then they get retained. I worked in A&E. I've been in A&E for like 3, 4, 5, 6, 7 years before I left and came to GP. What we found out in A&E is that by the time they are coming, these men, they are now they are in severe pain. By the time you do a scan of their bladder, you find 1,500 mils of urine.
Wow.
You find 1,000. And then you now say, what happened? Say, well, before I noticed about 3, 4, 5, 6 months ago, I've been rushing to go to the toilet frequency. Then I noticed that every time, even sometime before I get to the bathroom, I noticed that urine I can hardly hold it.
Hmm.
Some of them begin to have what is called incontinence. That is incontinence. So he's not able to hold the urine. The urine comes out on itself, by itself, and then he has to rush and quickly,
Hmm.
go to the bathroom. The challenge some men have is because they feel a bit embarrassed about this. They don't want to talk about it. That daddy is wetting himself or uncle is wetting himself. He doesn't want people to know. I think it's because I'm drinking too much water. So some of them don't present early.
That's true.
I'll tell us a quick story before I round up. I was in the clinic in Nigeria. A gentleman brought his father. I said, what is the problem? He said, my father has back pain. Back pain? Now, for us in the medical profession, there's a training. They give us a training. If you see a man or an elderly man that is having back pain,
Mm-hmm.
check his prostate.
Mm.
The reason is because you may say it's just back pain, it's the bones of the back. No, it may not be the bones of the back. It could be that he has developed an enlarged prostate that probably developed into cancer, and the cancer has now moved. We use the word metastasis. It has now moved to outside the prostate. It has now gone to the bones of the back.
Hmm.
And now he's having back pain. So they brought this man. He could hardly walk. He was having back pain. I said, okay. I said, gentleman, I'm going to examine your father. I said, sir, I need to examine your back passage. You know, in UK, we call it back passage,
Okay.
but it's rectal examination, but we call it back passage. So I said, I need to examine your back passage. And the son was looking at me, what, does this one know what he's saying? I said, don't worry. I will explain to you later.
Hmm.
By the time we examine the back passage, we find out that the prostate has become very enlarged,
Wow.
already having nodules.
Wow. Wow.
So what that man had originally was that he had developed, he must have been having, then I started asking questions, has been having frequency, urgency,
Mm.
nocturia is end.
Mm.
They go to the toilet more at night and they cannot even sleep very well. They say, I didn't have enough sleep because I was passing too much urine. Weak dribbling, weakness of their urine when they go to pass urine. It's only coming out very sluggishly. It's not going out very well.
Doctors,
Can I continue?
sorry,
Yes, ma'am.
doctor, can I pause? I know we'll soon get to
Yes,
question and answer time, but I got
yes.
something from what you just said now that one does not need
Okay.
to wait till you see symptoms before you go for
Very
check.
importantly.
Because
Yes.
that's a fact I want people to take away. You don't need to wait for any
Mm,
symptom before you go for
mm,
routine check. Is
mm.
that what you mean, doctor? Then
Yeah,
does
that's
it
what I
have
mean,
to
ma'am.
do with age? Is there certain age
Yeah,
you say, okay, I don't need to wait till I'm going to toilet often. I don't need to see any signs before I go and check my prostate. Is there
exactly.
any age that you say, okay, if you have reached
Yes,
certain age, you need to do this?
yes,
Okay,
yes, ma'am. 40 will be a good age, man. And to be honest, like you said, man, I decided to say that earlier so that I would not forget.
okay, okay, okay.
Because by the time we begin to talk about management, brachy, this one,
Okay.
irradiation, hormone therapy, all these things may not be very useful to the patient anymore, isn't it?
Okay.
You're talking about hormonal therapy, something that's metastasized to all the body you are not giving. So this particular programmer, I mean, this, like you said, I'm sure is the only spirit that laid this thing on your mind for me to be able to bring this. The essence of this is preventive.
That's right.
Okay.
That's right.
Yes, and that's why, as a GP training, this is why I'm very interested, because we want to see how we can prevent this from. Because what is the essence of it has not happened now? Well, now we can manage it
Um,
anyway. We'll talk about that. 40 is a very good age.
hmm,
For somebody who has a family history of prostate cancer, is a very good indication.
hmm,
For somebody who is a black man, is a very good indication
hmm,
to say, I don't have to wait for this. And I'm going to emphasize that even throughout the course of this talk.
hmm.
Do not wait for the symptoms
That's
before you go.
so.
Because by the time some of them are, hello,
I believe our audience, they are hearing this, that you don't need to wait for
okay.
symptoms. Tell your husband,
Mm.
your uncle, your niece, your family, your co-worker that you don't need to go, you don't need to wait for symptoms before you go for check. Thank you very much. Thank you, doctor. You can continue, sir. Please
Okay, ma'am.
let's know where you are connecting us from. Let's see you connecting us in the chat, appreciating doctor. And then your questions. We want to see your questions in the chat. Even though before you start asking questions, I have my questions already. So
Yes, sir.
please let's know where you are connecting us from, and let's appreciate doctor. Yes, doctor, you can continue. Thank you, sir.
Thank you, ma'am. And thank you very much, everybody. I've seen a lot of chats here welcoming us, and I can even see one Pastor Ilori here from Ogun State. I
Wow.
don't know who
Okay,
that.
Pastor.
Yeah,
Yes, yes. Okay, Pastor
okay.
Lawrence.
All right. Yes, ma'am. So about the symptoms, yes, we have talked about some of them.
Okay.
The other things is that some of them can begin to notice blood in their urine.
Mm, mm,
For us, for instance, now, if you are doing tests, one of the tests we do, we'll talk about it, urine test. If you do urine test, which is called urinalysis, urine dipstick, and you begin to find blood, a little bit of blood, yes, you can suspect what is called benign prostate enlargement. It is not cancer. It is just that the prostate has grown bigger than it should be for that particular person and for that age.
okay.
But if you see too much of blood, because the urine distich tells us how many pluses of blood. If I do the urine dip and it's not telling me that the person has 4 pluses of blood in the urine, that's suspicious. That is suspicious. So blood in the urine, somebody begins to notice that there's a change in the color of the urine. I think I'm passing blood, so that person has to be checked out.
Okay.
So weakness of the urine, frequency of the urine, having to rush to the toilet, urine is coming out before the person gets to the toilet, the person is now retaining urine, notices that now in the night he can't even pass urine again. Some of them they then come at that point. So what we do is we have to quickly put a catheter because they will be in severe abdominal pain. Do a scan of the tummy, you find out you are finding 1.5 liter. I've seen a lot of 1.5 liter, 1.8 liters of urine in the bladder. And then by the time you pass the catheter, all the urine will just form and the man will just slip off. But at that point in time, it means you now need to begin to ask questions. Is this just a normal enlargement of the prostate or is it cancer? And what we do in GP, we have talked about people not waiting. If you go to the GP surgery, go to GOPD, what should be done is we'll ask you questions. Have you been having symptoms? If the patient has been having symptoms, okay. Because for us, the way we make diagnosis, we ask questions, history.
Doctor, sorry, there's a question,
yes,
though I think we'll be going to question and answer time now. Pastor Ilori is asking, how often do you go for check in a year? Like when
yes.
you say you don't need to wait for symptoms before you go for check, how often does a man go for check in a year? Is it that once to go in a year, maybe it's in another 3 years or every year?
Yes. Thank you, ma'am. So that's a very important question. Thank you very much, sir. So it depends on what we find when the patient comes. Like I have said, a very safe age is 40. But if somebody begins to notice symptoms at any age, because you know the way things are going on in the world now, things are changing.
Yeah, honestly, a lot of things are happening. Yes.
A lot of things are changing. You see somebody at what age did you develop this? Say no, I just noticed it. So we were just using that 40 as like an example, basically.
Okay.
But if it happens before then, at any point, the person should come. But anytime the person comes to us, so what determines how frequently is that depending on what we find, and that is why this assessment we do is very important. If the man comes and I find out that, oh, okay, he doesn't have the symptom. Yes, he has a family history. He's a black man. He's more than 40. But I ask him, he doesn't have all the symptoms. We do examination of the back passage. Does he have an enlarged prostate? By feeling just in the back passage, looking for the prostate. Okay. But if I do the examination and I find out that the prostate is enlarged, or this gentleman, the prostate seems to be not just enlarged, it also seems to have some nodules. Those nodules are very suspicious. That kind of a patient, we then go ahead to do a blood test.
Okay.
The blood test that is done is called the one that is generally acknowledged and allowed for us to do, both even in the UK and US, even in Nigeria, is what is called a prostate specific antigen. It's a blood test.
Okay.
It's a blood test. The prostate secretes an enzyme which, by the time you do the blood test, is high for that patient. We have the normal range for different ages. From 40 to 59 to 50, there's a particular size of prostate, and there's a particular level of prostate specific antigen blood test that you should have. If the person now has what is higher than normal, at that point in time, I'm not going to say come back, come and do it 3 times in a year. No.